right, it's now 28 minutes to 9. We're on the final leg of the show this morning. And on Your Health today, we shall focus on liver disease and the possible ways of preventing and curing them. In studio for this conversation, I have two liver specialists, Dr. Eric Murunga and Dr. Abha Nagral. I hope I pronounced that correctly. Is that correct? Fantastic. Thank you for joining us. And before we get into the conversation, maybe let's just look at a few facts regarding the liver that you might be aware of or may not be aware of. And some of those facts basically that, well, in Kenya, the number one cause of liver failure and cancer is hepatitis B and C are unfortunately, basically are some of the reasons that we have. That in recent data, 150,000 blood donations in the country indicate that more Kenyans were found to be hepatitis B compared to HIV. All right. So other facts that we see is that the liver cancer is also among the top 10 issues that we have that affect us, regarding your liver. 40% of Kenyans attending liver clinics in the country are affected by hepatitis B and C. Data from the Ministry of Health and Gastroenterology, I hope I get that word right, Society of Kenya indicate that 60% of chronic liver disease and 80% of liver cancers causes in the country are due to chronic infection of hepatitis B virus. And finally, worldwide, 325 million people are living with chronic hepatitis B and C, and 1.34 million died from liver damage disease because they did not have access to saving treatment. So, of course, this means that it's a definite thing that needs to be looked into. So let me start with you, Dr. Eric Murunga, on possibly the functions of the liver.
Well, the liver is a very important organ in the body, and its primary function is to cleanse the blood of toxins. So anytime you eat anything or drink anything, the first place it goes after it's absorbed from the intestines is to the liver. And then any toxins are removed from there, then it can circulate to the rest of the body. All
right, maybe other functions, Dr. Abha?
So it stores important food material. So when a person is starving, the stored food gets used up because the liver has stored it. It also makes very important proteins like albumin and clotting factors. So if the liver doesn't work, the blood does not clot.
Okay.
So that's another important function of the liver.
All right. Now, I've heard, and I don't know whether this is true, you could possibly enlighten us on some of the main causes. We've seen that hepatitis and cancer are a major cause of concern, but are there things maybe to do with our lifestyle or diet that possibly affect our liver?
Yes, very much. One is alcohol. Alcohol in many parts of the world is still the #1 cause of liver disease. So excess alcohol is damaging to the liver. And of course, what you eat. It has been now shown that what you eat in your childhood changes your gut flora, the bacteria. We have millions of bacteria in our gut. And it is these bacteria which get modified by the kind of food you eat in childhood, which finally goes on to develop liver disease, like fatty liver disease. So what you eat also determines...
Is that just what you eat in your childhood or generally?
Oh, generally. But it may start in childhood.
Okay. Is that a cause of concern, Dr. Murunga, maybe based on our local indigenous diet?
You know, our diet is actually very good because you find, you know, when children are growing up, they're exposed to a wide variety of things. Food is not processed. And then the gut flora, like she's mentioned, these useful antibiotics that we need, you'll find that, you know, in our setup, we get exposed to the correct bacteria, and these are protective in the long run, as opposed to certain places, certain countries where everything is so sterile, they don't get exposed to the useful bacteria, and they tend to get problems like allergies and all these things. So our diet is excellent.
Okay, and now that you talk about, you know, sanitized and very, and where we are going, I remember, for instance, that this has probably nothing to do with the liver, but maybe we can transpose it to what we eat. And I remember when we were growing up, when you'd get your toe chipped, you know, by a stone, would actually put soil. I mean, to dry it. And I don't know whether that kind of increased our level of resistance and bacteria, but how does that flora affect us eventually?
So as he said, if you have a very sanitized environment, then the immunity of the body actually starts from the gut. So the gut immunity is not good. And then later on in life, you develop various problems related to that. Whereas on the other hand, if you have a lot of fiber in the diet, which I believe it is over here, and less of processed foods, it actually builds up gut immunity and protects the liver.
Okay. Before we come to the cure, are there some things that we possibly can look at as symptoms that can tell us that we're possibly having a problem or need to be checked in regards to our liver, Dr. Murunga?
Well, as you said at the beginning, the liver is kind of one of those silent, it's silent. By the time you get symptoms, it's probably quite advanced. So in most cases, the important thing is to get checked before there are symptoms. And that begins from birth by getting the hepatitis vaccine. So once people get the hepatitis vaccination, and it's available now, then they can protect themselves. But, if the symptoms are advanced and they can be noticed, a lot of times people will notice yellowness around the eyes. A lot of symptoms.
Is that what is referred to as jaundice?
That's jaundice. And a lot of symptoms are very vague. You might think you have a flu, maybe just joint pains, a bit of vomiting, and just the usual vague flu-like symptoms. But, you can have that or just weakness. When you go and get tested, the doctor might find that the liver enzymes are high, the liver tests are abnormal. And that's how you see it. So other than jaundice, when it's very advanced, you can have the abdomen swelling up because of fluids. Some people get to the point where it's really, really bad and they're vomiting out blood. So all these are symptoms that show a very advanced.
Okay.
Can I? Yeah, so just to add on to what he said, if you have somebody just coming with mild swelling of the feet, one should not ignore it, that you're standing too long or you're taking some drugs, because we often see that many chronic liver problems start with swelling of the feet. So don't ignore any swelling of the feet. Again, when a child is born, jaundice is very common. It's called physiological jaundice, which is a natural jaundice. And it's most of the childhood cause of liver disease, a disease called biliary atresia, gets missed because it is brushed off as a physiological jaundice. So if your jaundice prolongs beyond 2 weeks of birth, that needs to be immediately attended to, because if you operate on these children early, they can be saved.
They can be saved. Yeah. All right. So jaundice is not. It's not as specifically just liver disease. There are other causes of jaundice.
Yes.
Yes.
Okay. And then one would need to be tested. Would one experience jaundice even when you're advanced in age, as opposed to just babies?
No, but you can have blood causes. So if there's excessive destruction of red blood cells, that can also cause jaundice. So there are what we call hematological causes of jaundice, but most of the times jaundice is related to liver disease.
Okay. Dr. Murunga, what would your recommendation then be for frequency of being checked on your liver? Because you've mentioned it's very silent, and by the time one is getting the symptoms that are evident, then possibly it is advanced. So what do you recommend as a recommended time for, testing or checking?
We don't have very specific guidelines in place to say that, every year you get the liver test, things of that nature. What the most important thing is to get vaccinated. And now there is a childhood vaccination that is available for all children. But even adults, if you've never been vaccinated, because Kenya is a country where there's a lot of hepatitis B, so everybody really should get vaccinated. So the important thing is somebody who's not been vaccinated, who's not been tested, should immediately go and get the hepatitis B tested. So if you're negative, then you get vaccinated. If you're positive, you get treated. That's the most important thing.
And is there a frequency for the vaccination?
The
or is it one of those that once you've taken one, then you're good to go?
Yeah, it's a series of 3 shots. So once those shots are taken over a period of 6 months, then majority of people are fine. So you don't need to get re-vaccinated. Sometimes if somebody is maybe a healthcare worker where you're at high risk of this, then there might be room for testing to see if it's really working and get a booster dose. But majority of people just get the 3 shots and you're done.
Okay, causes of hepatitis?
So when we talk, hepatitis is a very broad term.
Right.
When you say any itis means inflammation, swelling. So hepatitis, hepa is liver. Hepatitis means swelling of the liver. So it could be a viral hepatitis, A, B, C, D, and E. It could be a drug hepatitis. Many drugs cause hepatitis, and when you ask causes, you should look at drugs, especially painkillers like ibuprofen, diclofenac, nimesulide. All these can affect the liver. Many antibiotics, anti-tuberculous drugs, all can affect the liver and cause a drug hepatitis. There's something called an autoimmune hepatitis. And there's something called fatty liver disease, which can cause steatohepatitis. So and of course, we have alcoholic hepatitis. So hepatitis is a very broad term. And when we have a patient with hepatitis, we try to find out which of these the patient is likely to have. Okay.
Now, it's worrying to hear that, some of the drugs could actually cause hepatitis. Is that for certain people? There's normally, when you're being administered to drugs, they ask you, are you allergic to something? Is it something that is known that it affects certain people, or is it over prolonged periods of taking certain drugs?
Yeah, so that's a very important question. It's not allergy to the drug. So if you have a patient who has, say, a fatty liver, or who's consuming excessive alcohol, and then he takes a painkiller, he will be much more prone to developing drug-related liver problems because he already has a pre-existing liver disease. So these are the people who are more prone, or there are people who take drugs in excess. So there are some drugs which cause hepatitis only when taken in excess doses, and there are others which cause what is called an idiosyncratic reaction, which means even one single tablet can cause hepatitis. So I think one needs to know what the baseline liver function is before such drugs are given. Of course, it cannot be recommended as a general thing, because every time you take a painkiller, you're not going to go and do your liver function test. Right. But people who are consuming alcohol on a regular basis, who are known to have liver cirrhosis, who have fatty livers, these are the people who should be careful, and we recommend that they should not be taking any painkillers except paracetamol in restricted doses, which is safe for the liver.
All right, Dr. Murunga, on that question of drugs, what maybe are the things that we should be concerned about when you're getting a prescription? If you wanted to engage your doctor, are those some of the questions that maybe you should find out?
Yeah, there's some drugs that just have a higher tendency to cause liver damage or liver toxicity than others. And so if such a drug is being given, for example, some of the ARVs given for HIV, there's some of them, when they're given, the doctor will come up with a program of, okay, we're going to check your liver enzymes, liver test in about a month or 3 months. There's a schedule for each of them. So that's what the doctor would recommend. And then the others which it's extremely rare to get a liver disease from them, but it could happen. And in those, there's really not much one can do, such as monitoring, as Dr. Arya said. It's just one of those very rare things.
Okay. So, Dr. Abha, you're practicing in Apollo Hospital, Mumbai, but you're in Kenya for a reason. Maybe tell us a little bit about that.
Yeah, I've been to Kenya many years ago, more than a decade ago, and I'm a nature lover.
And I hope Kenya is treating you well.
Yes, it is very much, and I look forward to that.
Okay, yeah. But there's something to do with liver transplant. Maybe tell us a little bit about that.
Yeah, so liver transplant is I would say, the final curative treatment for many liver problems, which are very progressed. So if you have an advanced cirrhosis of the liver, cirrhosis means that the liver is scarred and shrunken. When patients would develop fluid in their tummies, blood vomiting, as he said, or they have excess ammonia. Ammonia is a toxin which gets into the circulation, but a normal liver can detoxify it. If the liver does not work, it gets into the brain and causes right from irrelevant behavior to even coma. So these are complications of cirrhosis, and if these occur, then the patient is a candidate for liver transplant. Or sometimes the patient comes with acute liver failure, a person who has no idea that he has any liver disease and does not have any liver disease, acutely due to an acute hepatitis B maybe, acute hepatitis A. There are several causes of acute liver failure. Just the liver packs up, and this patient also sometimes needs a transplant. Liver tumors, if there are tumors which are not resectable, which fit into certain guidelines, these two are candidates for liver transplant. So basically, liver transplant means replacing the old liver with a new liver when there is end-stage liver disease or liver tumors which are not correct.
Okay, and it is a process that works. What's the percentage success rate?
Yeah, in established centers, it's as good as 90% is a 1-year survival, and it goes on to be about 80-85% 5-year survivals, which is pretty good.
All right, Dr. Murunga, where this is going to be taking place as we wind up?
Well, right now we don't have liver transplants in Kenya, and this is one of the few conditions where we have to ship or we have to send patients abroad to get that treated. So right now, a number of our patients go to India, but we are in the process of setting up liver transplantation in Kenya. So we are hoping that we'll be able to do it here within a short time. And it's through collaborations with other centers which are doing it, like in India and places like that, that we're going to go forward, and soon we'll be able to do everything locally.
Okay. Well, as we wind up, closing comments and possibly your advice for a healthy liver. What do we need to do?
Yeah, so I would say that look after your liver as much as you look after your heart. It's as important as your heart.
Okay.
So don't ignore the liver.
Dr. Murunga, parting shot?
Just to recommend everyone to take care of their health, getting checked, because a lot of times we wait until we are sick. But especially from the age of 45, there's a series of tests everybody should do, including cancer screening. There are tests for that. And these are things we should be taken very, very seriously, as well as vaccination during childhood.
Okay, and I know we put a lot of emphasis on the heart. In fact, when people say they're in love, they say, I love with all of my heart. So I guess with the liver being that important, we also should include it in some of that. Maybe instead of that, I love with my heart, you make my liver quiver or something. Yes, you wanted to say something?
Yes, so people think the alcohol protects the heart, so it's okay to take, but now the recommendations are don't take more than 2 units of alcohol in a day for men, and not more than a unit of alcohol for women, because women are more prone to developing alcoholic liver disease than men.
Okay, and if possible, you can avoid the alcohol altogether.
Nothing like that.
All right,
yeah.
Well, it is now 10 minutes to 9 o'clock, and we'll have to wind up there. Thank you very much for joining us this morning.
Thank you.
And that's where we wind up the show this morning. Thank you for staying with us. And at this point in time, we wish you all a fantastic day and a productive day. Do stay with us on KTN News as we have News Center lined up for you. God bless.